Now in its 14th year, the 2013 Lakeland Breast Cancer Awareness Luncheon brought together women from across the community in an effort to share knowledge and inspiration regarding the disease. Sponsored by Watson Clinic and Moffitt Cancer Center, the event drew hundreds of attendees and breast cancer survivors to the Lakeland Yacht and Country Club, where they heard from specialists from the Watson Clinic Women's Center, the Center for Cancer Care and Research, and Moffitt Cancer Center. Luncheon chairperson Mrs. Janet Tucker served as the MC for the festivities, which began with a stirring presentation from young breast cancer survivor Liesl Weeks.
I would like for y'all to know that through your doctor, listen to the plans, you take their advice, and you do what they tell you. I am living proof you can survive it 2 times.
Well-known musician Lisa Pallas led the audience in a sing-along to an original musical score that she wrote specifically for the event. Cheryl Bellinger from Moffitt Cancer Center spoke on the importance of the creative arts during the healing process. Ms. Bellinger is the Arts and Medicine Coordinator for Moffitt, a program designed to promote patient healing through interaction with art and music therapy.
Recognizing that all medicines does not come in a bottle, Moffitt leadership established arts and medicine nearly 16 years ago. And it really does make a difference.
Her presentation was followed by Dr. Elizabeth DuPont, a Watson Clinic breast surgeon and medical director of Breast Health Services. Dr. DuPont spoke on a variety of issues, including the importance of exercise in cancer prevention.
Just walking an hour a day, just taking an hour and walking around this beautiful lake a day will reduce your risk of having a breast cancer by about 14%.
The benefits of 3D mammography at the Women's Center.
Probably about 450 facilities in the United States have the 3D. Maybe, I'd say less than 50 in Florida have the 3D mammogram, and we have ours for over a year now.
And the options available to women who are considering a mastectomy procedure following a breast cancer diagnosis.
What's happening with everybody getting mastectomy? Everybody I know of is getting mastectomy, and some people are having the other side removed. This is called contralateral prophylactic mastectomy. And recent studies have shown that there's a strong increase in taking the other breast off. And this procedure nearly eliminates the risk of developing it in the other side, but there's not really a lot of evidence that it really influences long-term survival.
An interactive question and answer session concluded the event as Dr. DuPont and Ms. Bellinger were joined by Center for Cancer Care and Research oncologist-hermatologist Dr. Galina Vugman.
I know that a lot of my patients do tell me that their thoughts aren't quite as clear, aren't quite as sharp. And you do have to realize that besides for those women or men who do take chemotherapy, there has been surgery, there has possibly been radiation. So to attribute the different kind of thinking, the memory issues just to chemotherapy is difficult, and it's difficult to study. And so you have to study very defined populations of people in order to really say that chemotherapy is what causes this.
Watson Clinic's Women's Center plastic and reconstructive surgeon, Dr. Faiza Kazmir.
I will see sometimes people come in with an asymmetric shape or volume, and I want to know what their options are. So they can range from considering a lift if the size is about the same, but that other breast is just more droopier. Or it can involve a breast reduction to reduce that larger breast to match better with the left side.
And radiation oncologist, Dr. Sandra Shaw.
Why? Because we have many patients that will come to us, well, I'm getting radiation, do I have to get chemo? Well, I got chemotherapy already, do I have to get radiation? But they do two different things. The radiation is helping to prevent the local recurrence, right? The radiation is getting targeted at the breast. If there are any remaining tumor cells in the breast, the radiation is taking care of that. The chemotherapy, on the other hand, is trying to prevent any distant recurrence, i.e. the chemotherapy goes into your veins through a peg line or whatever. It goes into your system, and it goes throughout the whole body. Why? Because your veins go through your whole body. Okay, so the chemo goes to everywhere, to your liver, to your bones, to your lungs, to your whatever, and it's trying to get rid of the microscopic tumor cells that are elsewhere in the body. And that's why the two of them must work together. We use chemotherapy to try to prevent a systemic recurrence, and we use radiation therapy to try to prevent a local